Kia ora everyone and welcome. As your animal care tutor right here in New Zealand, I am absolutely thrilled to guide you Level 3 students through this explainer on Unit Standard 31503. Today we're focusing on the very first and honestly arguably the most important step of any companion animal examination, and that's the distance examination. Okay, let's dive into this. Before we get hands-on with our patients, here's our game plan for mastering today's assessment criteria. We're going to cover the detective mindset, observation before touch, establishing baselines, decoding BAR, and finally, safe handling next steps.
Section 1. The detective mindset. I want you to really frame the clinical exam as a detective investigation. Before you ever interact with your patient, before you lay a single hand on them, or even try to soothe them, you've got to stand back and just gather clues. This brings us to a really foundational idea in veterinary medicine. We miss more by not looking than by not knowing. So the crucial point is, most diagnostic errors in the clinic, they don't actually happen because you lack textbook knowledge or haven't studied your anatomy hard enough. No, they happen because of insufficient observation. If we jump straight in without looking closely first, we completely miss those vital subtle clues the animal is naturally giving us about their health. Section 2. Observation before touch.
So why must we absolutely observe before we even think about putting our hands on the animal? Well, it all comes down to capturing them in their most natural, stress-free state possible. If you rush in and immediately start handling them, you risk triggering what we call the white coat effect. This is this physiological response where fear, anxiety, or honestly, even just simple excitement causes a massive spike in the animal's heart rate and adrenaline. And when that adrenaline is pumping, it completely masks their true state. Suddenly, that slight limp they had when they walked in just vanishes, or their breathing rate goes through the roof, but it's because of stress, not illness. If we don't observe first, those genuine baseline clues are hidden from our assessment entirely.
And this brilliantly illustrates exactly what we mean. Sometimes being a top-notch clinical detective means literally getting right down on the floor to gather your clues without causing any extra stress. By staying low and just keeping your distance, you allow the animal to settle into the room. You can watch how they breathe, how they hold their head, how they naturally interact with their owner, all without interfering and triggering that dreaded white coat effect. Section 3. Establishing baselines. So while we're down on the floor or maybe standing quietly across the exam room, what exactly are we looking for? Well, from our safe distance, we are looking to establish baseline data about how the animal moves and how it thinks. For your Unit 31503 practical assessment, you're going to use a specific distance observation checklist to gather this exact baseline data. You're looking at identity and signalment, which just means species, breed, and approximate age. You're checking their physical stature and body condition score. You're looking at external quality, like, the overall condition of their coat. Crucially, you're watching their mobility and stance, like their gait. Are they shifting their weight? Are they limping at all? And finally, you assess vitality and their behavioral baseline. Remember, Level 3 students, you've got to record at least 5 of these features accurately from a distance to pass this practical evidence requirement, so pay close attention. Now, it's totally vital to remember that not all animals are going to show baseline clues the exact same way. We really have to understand the difference between predators and prey. Predators, like the dogs and cats you'll be seeing, usually show pretty distinct body language, maybe a tail wag to the right or a lowered head indicating fear. But prey animals, like the rabbits and rodents you're also going to assess, they require incredibly astute distance observation. Because think about it, their survival instinct in the wild is to hide illness and pain. They will naturally try to mask their symptoms. A rabbit in severe gut pain might just quietly hunch over or press its belly flat to the floor. You have to be a really sharp detective to spot those subtle prey baselines before you even think about touching them. Section 4. Decoding BAR. All right, let's move from observing the physical body to assessing the animal's mental state, which in the clinic we refer to as their mentation. This brings up a really important practical question for your clinical logs. How do we quickly and accurately record how an animal is thinking and feeling without having to write out this massive subjective paragraph? Well, we use a specific industry standard acronym that you're going to use in almost every clinical record from here on out. That acronym is BAR. BAR. It stands for bright, alert, and responsive. Now, what's really interesting about this slide is how these 3 simple words give us a complete, clear picture of a healthy mental baseline. Bright means the animal is active and aware. They aren't sluggish or confused. Alert means they actually notice things happening around them, sounds, people, movements. And responsive means they react normally to those stimuli. If an animal isn't BAR, they might be unusually drowsy, depressed, or just completely out of it. And that immediately flags a potential issue, like a toxic illness or severe distress. Section 5. Safe Handling Next Steps. Let's move to and see how this builds. How do our distance findings actually dictate what we do when it is time to get hands-on? Ultimately, distance observation is your absolute first line of defense for safe and accurate hands-on handling. If your distance exam reveals a highly stressed, nervous dog, or maybe a rabbit displaying that hunched posture of severe pain we talked about, you now know you must adjust your handling approach. You have to keep yourself and the patient safe. Mastering this distance exam prevents injury, it helps keep the animal calm, and it sets you up perfectly to transition into the systematic, hands-on, head-to-tail physical check. I want to leave you with this final, really important thought before you head out into the clinic. If you rush the distance exam and trigger that white coat effect, what vital clue might you erase forever? Is it a subtle limp? A slight respiratory wheeze? Observation is, without a doubt, your most powerful diagnostic tool. So take your time, practice your observational patience, and always trust your eyes before you trust your hands. Thank you so much for joining this explainer, and I absolutely cannot wait to see your detective skills in action during your practical assessments.